I chose Vietnamese for my cultural paper. Overview of the Vietnamese culture. Culture is strong and considered one of the oldest in Southeast Asia. Vietnamese culture is heavily influenced by Chinese cultures and customs in terms of their government, politics, moral and social ethics, and artistic creations. Vietnam gained their independence from China during the 10th century and immediately began expanding to the southern region. Territories that belonged to the Champa civilization were annexed and acquired by the people of Vietnam. They were also colonized by the French people for a short period of time, allowing Vietnamese people to absorb influences from European people like the spread of capitalism. Biophysical characteristics of Vietnamese people. Their hair texture of the culture group is typically straight or wavy. They also have almond-shaped eyes typical of Asian ethnic groups. Vietnamese people are often seen to have broader noses. They have a smaller body frame than the Chinese, and they are quite short people bearing a darker complexion and fuller eyes. Communication in this group. Primary language is Vietnamese, but many living in the United States can speak English. Announcing the order of their names correctly and addressing them as Mr. and Mrs. is an acceptable form of respectful communication. Vietnamese people are not comfortable with participating in therapy and counseling. Silence is valued. Eye contact may be considered inappropriate or disrespectful. Criticism or disagreement is not expressed verbally. Head nodding does not always mean agreement. Values in this culture. Aside from their Catholic religious beliefs, many Vietnamese people are followers of Confucianism. This system of beliefs has a code of ethics that must be respected and is built upon four main beliefs. These can influence the way nurses interact with their patients and the family members of the patients. Number 1, lifelong obligation to their family, elders, and parents. Number 2, strong respect for authority and education. Number 3, protecting and maintaining the family reputation. And number 4, achieving harmony in society. Family and relations. The oldest male in the family is normally the decision maker and will act accordingly on everything outside of their home. If the oldest male in the family cannot decide, then the next eldest male would be responsible for providing their consent. The wives are responsible for caring for the family and the home, while the elders are the highest respected members, with the children being taught to respect them. For a family with traditional Vietnamese views, it would be proper for a nurse to first consult with the eldest male of the family to ensure their course of actions are respectful and acceptable. The roles for Vietnamese people that have lived in the United States for a longer period of time are more aligned with American views and methods of operations. Health practices. Many Vietnamese people do not trust medicine from Western nations and will only utilize it as a last resort. Immunizations and invasive procedures may be met with resistance because they feel that clinicians who intrude on their bodies are not the ideal healer. Their belief that physicians can diagnose an issue by looking at them and checking their pulse is ideal. They prefer acupuncture as a method for combating strokes, arthritis pains, visual issues, and many other symptoms. Vietnamese people are more likely to avoid Western medicines and ignore prescribed drugs. Nurses must be aware of the dermoabrasive procedures that Vietnamese people utilize and not mistake it for physical abuse. Health trends and issues. Vietnamese people not born in America suffer from different health issues due to poor living conditions, abuse, and starvation during the Vietnam War. They have a history of medical conditions like Hep B, tuberculosis, anemia, leprosy, and much more. Cancer is one of the leading causes of death for Vietnamese women and men that live in the United States. Women are 2.5 times more likely to have cervical cancer in comparison to all other ethnic groups. Men have a higher chance of developing liver cancer, lymphoma, and nasopharynx cancer. Other common diseases include stroke, heart disease, diabetes, and high blood pressure. Nutrition in this culture. Foods are a major part of their health and maintenance. Vietnamese people link illness to come from imbalances in the body like dark, cold, female, and light, hot, and male. Foods, medication, illnesses, and herbs are hot or cold. Examples of cold foods are rice, tea, water, vegetables, fish, and fruits. Examples of hot foods are eggs, peppers, sweets, and meats. End of life care for this group. The family is extremely involved in healthcare decisions when someone becomes terminally ill. The elderly man is usually the person responsible for making the final decision. Families are most likely to have the patient from negative news. It is important for healthcare providers to check with family and the patient to learn how medical information is disclosed and who it should be given to. There are many visits from friends and extended family members when a patient is dying, and upon their deaths, the coffin is usually placed in their home for 3 days to allow family and friends to place their respect for the patient. Vietnamese people are a unique group that come from the southeastern part of Asia. In the last 3 decades, many of them have come to the United States in search of a better lifestyle for the chance to experience West culture. Their healthcare needs are unique and different like the various demographics over the world. Nurses must be aware of the special attention to their culture influences and needs. Their culture values the elderly, politeness, and being able to maintain confidential information about terminal illnesses. As a proudful group of people, the Vietnamese are not big on sharing matters of mental health issues with the general public. Factors like their diets, physical health, and emotional health must be taken into consideration by healthcare professionals. Their hot and cold style of dietary needs play a role in the foods that are served while under the care of a nurse. Their religious beliefs also must be respected, as a demographic can include Confucianism, Catholicism, and Buddhism. Each religion has its remedies and beliefs when dealing with medical conditions and their treatments. For nurses, the people of Vietnam are a prime example of the care and attention needed for the different patients in the world.